So I'm going to talk more about the proximal sensory systems because this is important. When you see us in therapy and OT, we do a lot of gym activities. We put them on a swing. We engage your vestibular system. We do with a lot of tactile play. We play with putty. We play with kinetic sand. We do messy play because we really want to engage that system and we really want to balance that system and integrate all of these functions. We also work on a lot of obstacle courses because we want to activate that joint and muscles in order to kind of create that full system that's needed to build up into the higher levels of cognition. So tactile, it's located in your skin. Touch receptors provide us with information about the world. When we feel it, when we feel something on our hands, our brain processes that information and we get to respond to that stimuli. Vestibular information is when you are on a swing, you need that vestibular to keep your head in position and movement. So when you do a lot of flips, when you do a lot of rolls, when kids crawl, that they are able to develop that vestibular system. And proprioceptive, there's a lot of the jumping jacks, planks, crawling, all that system is activated when kids engage in that. Okay, I'm going to talk about the interoception, which is our internal organs, and it provides us information about our bodily functions. If we're hungry, we're thirsty, we're out of breath, we have some pain, our temperature's a little too high or too cold, our heart beats too fast or too slow, we have muscle tension, and we need to use the bathroom or eat. So all of these are important because we need to make sure that our bodies are regulated so that we can go and do higher level functions. So once we take care of that and we understand that our kids need that taken care of because it's in the base of our pyramid, then we could help them have and live a meaningful life, and they can engage in a lot of activities that they want to engage in. Okay, so what is a sensory processing disorder? So a sensory processing disorder is a condition in which the brain has trouble receiving and responding to information that comes through our senses. So it's as if the Wi-Fi signal is off. You can do certain functions, but it would be difficult for you to complete the task, like send that email to your boss or be able to connect and go to a different website. When there's a sensory processing disorder, there's a disconnect. When we get that information, when a kid gets that tactile information, they may not get that information to their brain, or the brain might not be able to respond back to that stimulus, and it affects them. They don't feel that they're in their own bodies. So we have to kind of jumpstart that Wi-Fi, maybe do a lot of activities in order to build that connection if that connection was never established in the first place. So sensory processing disorders are so people that have sensory processing disorders are oversensitive to things in their environment. Common sounds may be painful or overwhelming. The light touch of a shirt may shave their skin. And you could see this manifesting in uncoordinated movements. A lot of these kids bump into things. Loud noises are too much for them. They're not able to listen to instructions. They can only understand one-word instructions. It's hard for them to engage in conversation or play. So these are some signs of sensory processing disorders. So the sensory processing disorder is divided into different spectrums. So there's the sensory modulation disorders, and the sensory-based motor disorders, and the sensory discrimination disorders. So again, looking back at our pyramid, it has to do mostly with the first few layers of our pyramid. And if there's a disorder, it's really difficult for your child to be able to achieve that higher level cognition. So here in the sensory modulation disorder, there's three different categories. There's sensory over responsivity. Sorry, I couldn't pronounce that. And then there's the sensory under responsivity, and there's sensory craving. And then I'll talk more later. I have more slides about that. And then we have the sensory-based motor disorder, in which kids have difficulty with coordinating their movement, keeping their bodies upright. And it's divided into two: dyspraxia, which is motor coordination, difficulty planning motor movement, and postural disorder, difficulty keeping their bodies upright. I know they could be interchangeable, but they're different. And then we have sensory discrimination disorders in kids that have difficulty with their visual systems, auditory systems, tactile, taste and smell systems, position and movement, and then finally interoception. So these are the three different categories of sensory processing disorders. We'll talk about the first one, sensory modulation disorder. It's a problem with turning sensory messages into controlled behaviors that match the nature and intensity of our sensory message. So here, if someone has a sensory modulation disorder, it's as if you're putting too much voltage on an extension cord. It would overheat and maybe cause like some issues that cause a fire maybe. So that's essentially what's happening in your kids' brains when you're giving them too much stimulus. You add too much stimulus in their brain, they overload and they have a meltdown. And for a lot of these kids, their threshold is a lot lower. They hit that threshold faster than most kids, and maybe a simple light or simple touch could send them into a meltdown or send them into a fight or flight mode. So we need to understand that so that we could assess that, and you could talk to your therapist about that and they could address that in their sessions. So I'm going to talk more in detail about the different sensory modulation disorders, since we've been talking about that in our chart, and I'm sure all of you are curious as to how to delineate that. It's important for us to identify what the issue is so that we could help treat what the issue is, and we could have results and be able to get data on it and get some progress on that. So sensory over responsiveness. So this is a predisposition to respond too much, too soon, or for too long to sensory stimuli that most people find quite tolerable. Like loud noises, like a sudden honk could send them into a panic or send them into a meltdown, or a scream or a random noise could send them into a fight or flight mode. So these kids are sensory over responsive. And it's important for us to understand that it's okay for them to have that. It's not that they want to be over responsive, it's that their brains can't process the stimulus that's happening. And then we have sensory under responsive, and these kids, and you could be both too. You could be some of your kids could be over responsive and under responsive at the same time. Under responsiveness is the predisposition to be unaware to the stimuli around your environment. So a lot of these kids are unable to are not doing well in school because they're not able to listen well to their teachers, or they're not able to process information, or sometimes even simple 1 to 3 step instructions are very difficult for them because they're not able to process that response. So these kids are under responsive, but they could be both. They could be over responsive to certain stimulus, but under responsive to some stimuli as well. And then finally, we have the sensory craving modulation disorder. Kids just need a lot of that stimulus. A lot of them want deep pressure, or they try to run into things because they like that feeling, or they get into a lot of fights because they get that response, or they like the trampoline, or they like to get wet. They love swimming. So these are examples of sensory craving, and your kid could have all three. And so sensory craving is driven to obtain sensory stimulation, but getting these stimulation results in disorganization and does not satisfy the drive for more. I've treated kids that have high sensory craving, that when they're on the swing, they spin around for so long that they don't even get dizzy. And in fact, it makes them more disorganized. They get more in the yellow zone. They're more dysregulated when they go on the swing instead of that calming movement. Of course, rotary movement causes them to be more dysregulated. So it's important for them to go in a linear pattern so that they can go back in the green zone. But even then, for kids that have sensory craving, even the slow, linear, gradual swinging could cause them to go into the yellow zone and get dysregulated. Okay, so sensory seeking, we talked about that, very similar to sensory craving. In fact, you could switch those two. A lot of kids are sensory seeking. They like crashing, bashing, bumping, jumping, and roughhousing. They constantly touch objects in the absence of specific patterns. They intrude on people. They're unable to take turns. They're unable to stop talking. They play loud music and TV. They also prefer food with strong flavors, so like bitter, sour, spicy. And they often lick, suck, or chew non-food items. A lot of the times this could be interchangeable with pica. And it's important for us to know this and note this so that they're just not eating random things in the classroom or in the house. And they have difficulty engaging in lengthy activities. Like for a lot of these kids, they could engage for 5 minutes and then they get dysregulated and distracted. And for some, I've seen kids that couldn't even maintain attention for longer than 5 minutes or 5 seconds, 10 seconds. And you need that one-on-one support. And again, it's a spectrum, and it's okay where your kid's at. That's why we're here. We want to be able to support you wherever your kid is at. Okay, sensory-based motor disorders. So when you have that issue with the tactile proprioceptive system and vestibular, you have a lot of postural disorders. You have the impaired perception of where your body is in relation to the space. They have poorly developed patterns and different, and their core isn't as stable, and they appear weak, and they have difficulty with their endurance. So this affects them later in life, especially in PE, because they want to engage in PE, they want to engage in sports, and they're unable to because they have difficulty perceiving where their body's in space. This could also lead to difficulties with activities of daily living, such as just buttoning their clothes, staying upright, putting on their pants, because they can't maintain that balance. And it also could affect in school for handwriting and keyboarding, because they can't maintain their posture upright. They can't hold a pencil or a pen the proper way. And this could also lead to dyspraxia. They have difficulty thinking of planning or making that skilled movement, especially in new patterns. So you see that a lot with jumping jacks. Of course, there's a certain age when kids can do that, when they have that develop that bilateral coordination. 5 or older kids should be able to somewhat get jumping jacks, but a lot of kids with dyspraxia have difficulty planning, crawling, completing an obstacle course, going up or going down, and it's pretty obvious they run and bump into things a lot, and crossing the street is really dangerous for them. I wouldn't. So these are just some things that we can see with a sensory-based motor disorder.